name's Lexi. I'm going to be your nurse today. I'm going to wash my hands, provide my privacy. Can you tell me your name and date of birth? John Doe. Date of birth 12/12/1999. Okay, so I matched that with the wristband. I go ahead, I'm going to check my MAR. So I can see we have an order for IV insertion today. I'm going to go ahead and check the expiration date and the normal saline, and I see we're good for that. So today, John, what we're going to go ahead and do, could you tell me if you have any allergies at all? No allergies? Okay, good. So today I can check on the order and I see we have an IV insertion. So what we're going to do with that is we're going to insert an IV, then we're going to have a catheter that stays there, then we'll put normal saline through the catheter so you'll have an IV in your arm. Okay? Do you have any questions? No? So if this patient did not understand what was going to happen, then I'll go ahead and grab another nurse, have the nurse hold down the arm to keep it nice and still. If this was a pediatric patient, I would use a smaller gauge needle. So I've gathered all my supplies here. I'd use a smaller gauge needle, and I would have their parent in the room or demonstrate on a teddy bear ahead of time. So I'm going to go ahead and I'm going to wash my hands, and then I'm going to take my normal saline, go ahead and get out all the air. So I'll go over to the garbage can over here, get all the air out, loosen the cap, and then I'll put it back in the package so that it stays nice and sterile. Then what I want to go ahead and do is I want to loosen the cap on my needle and make sure that the catheter will go in nice and good. So when I insert my needle. Then next what I'm going to go ahead and do is I'm going to wash my hands, and then could you lift up your arm for me please so we can put a towel under? Thank you. But first before we do that, could you tell me what your non-dominant arm is? Okay, so your right arm. So we're going to go ahead and use that arm, but first tell me, have you ever had a fistula in that arm? No. Have you ever had a mastectomy in that side? No? Okay, good. Then we'll use this arm. So go ahead and lift up. I wash my hands. Then what I'm going to go ahead and do is I'm going to apply my tourniquet 15 to 20 centimeters above the insertion site. So I know that we're going to use this insertion site because I can see desirable straight lines, veins, and then I can see that it's away from the distal joints. So we're going to go ahead and go in the forearm right here. Then I'm going to palpate the site. I wash my hands, palpate the site so I can feel that vein nice and good right there. So I'll wash my hands again. Then I go ahead and apply the arm in a dependent position, and then ensure that if I was having trouble finding the veins, what I would want to go ahead and do is apply a warm compress for 10 to 15 minutes after releasing the tourniquet. So I'm going to go ahead, wash my hands. So alright, so I'm going to put this tourniquet on you, okay? Quick release knot. Wash my hands. Don my gloves. We're going to go ahead, check for a pulse before I put on my gloves. Feel there's a pulse. So now within 2 minutes, going to insert this IV. So pull the skin taut, 15. Before I do that, I'm going to go ahead and recap my needle. Then I'm going to go ahead and go in to out. Allow that time to dry. Go ahead, grab my needle. Pull the skin taut. 15 to 30 degree angle. Go parallel. Once I see the flash, then I want to go ahead and insert another 1/2 centimeter. Then I'm going to grab and then pull all the way to the insertion site. So it's there. So now I'm going to go ahead to release the tourniquet. and do is I want to hold here, and then what I want to do is, how are you doing? Okay? So recap the needle and dispose, and I would make sure you hear the click of that, but we're not going to do that today. Then what I'm going to go ahead and do is grab the normal saline, and then use sterile technique. All right, hold the catheter nice and still. And then what I'm gonna go ahead and do is administer the normal saline. So I check the expiration date, and then we'll check for any phlebitis at the site, infiltration, any redness. Are you feeling any pain, any tenderness? None? Okay, good. All right, so that's all infused. So now what I wanna go ahead and do is, I wanna leave that on for a second. And then what I'm going to do is hold the catheter nice and still. You don't want to tape over the hub. Tape over the pink part here. And this tape is being difficult, but normally this would not happen in practice, and I would have a second nurse helping me right now. So tape all the way over the pink, not taping the hub. Good. So now what I'm going to go ahead and do is I'm going to put my initials, the date, the time, you can see. Then I'm going to go ahead and release my normal saline so it has no pressure on the vein. And then I want to make sure I keep this nice and stable. And then I want to go ahead and clamp. And then I want to ensure that we're very careful with this IV, but what I want to do is I want to tape, not taping over the hub. Okay. And you do not want to touch the hub. And I would tape per agency's policy, okay? And that there would not be touching the tape because you want to don't want to touch the tip of that. So I would go ahead and I would take off my gloves. How are you doing, John? And then I'm going to go ahead and the saline flush, the saline lock should be flushed at regular intervals per the agency's policy when not in use. So I'm going to go ahead and wash my hands, and then I'm going to lift up your arm, John, okay? Are you feeling okay? I don't see any redness at this side. It's all taped up and good for you now. I'm going to dispose of my supplies. Go ahead and lift up your arm one more time with a tourniquet. Thank you, John. And then what I'm going to go ahead and do is I'm going to wash my hands. And then I would ensure that my patient is nice and comfortable, so I'd make sure that my patient is in a low locked position with their call light, and then I would ensure that I put my sharps in the sharps container. I would ensure that I would ensure to document the amount of attempts, and then the amount of milliliters that I infused, so that was my normal saline, and then I would document the type and the gauge of my needle used. I would go ahead and document where the IV insertion site is, so on this would be the right arm, and then in the forearm, and then I would go ahead and I would document how the patient tolerated the procedure, document the date, the time, my initials, the client's response. I would document the size of the needle, and then the number of attempts, like I said, and then I would ensure to document I would make sure to document something else. The time, I said that. I said the number of attempts. The size of the needle, which I said. I'll go ahead, wash my hands, and then and I'm done with this procedure.